like suppose I counsel a set of parents that their child needs heart surgery. So they say
Absolutely.
like, why should I put my child through the suffering and pain of surgery? So that's when we try to explain to them that the suffering of pain of the disease is actually much more.
Hello and welcome to Doctor Story, everyone. Congenital heart disease. Congenital heart disease or CHD describes a number of different problems affecting the heart. It is one of the most common types of birth defect. It causes more deaths in the first year of life than any other birth defect. Today we have with us Dr. Haripriya, a specialist pediatrician with nearly 14 years of experience in the field of general pediatrics and pediatric cardiology. She is very passionate about treating children with CHD by providing holistic care, which involves antenatal, neonatal screening, community screening, treatment, and formation of support groups to ensure long-term care of these children as they grow into adults. A very good afternoon, doctor, and welcome to Doctor Story.
Good afternoon, Anchal. It's great to be part of Doctor Story as well. Thank you.
Most welcome. Talking about the CHD, what are the different congenital defects affecting the heart?
Congenital heart defects, as the name goes, these are developmental defects in the heart which are obvious at birth itself. In fact, they actually are because of during development, the fetus is growing inside the mother's womb. So these defects can range from very simple defects like which are called the common parlance as hole in the heart, and they can range to more complex ones like where there are major connection abnormalities inside the heart, when there are obstruction to the blood flow which come out of the heart, when there is difficulty in the way the blood enters the heart, abnormal pathways, the way blood enters the heart. Okay. These are the common ways in which we can explain the congenital heart defects. But each of these have a different kind of presentation and they affect the children in various different aspects.
So if without treatment, which of them can cause serious health problem or, are fatal?
If we look at congenital heart diseases, there is one group called the critical congenital heart disease. So these are ones which are present as critical problems in the neonate, like in the newborn baby. So these defects are classified as those when left untreated, definitely is fatal to the baby. So the most important thing in these babies is to how early we suspect them, detect them, and then offer treatment at the appropriate time. That is what determines their outcome essentially.
So if we could come out to the risk factor of it, who is at the most risk for CHDs then?
If you ask me about risk factors, congenital heart disease is usually known to occur because of what we call a multifactorial inheritance. There is no specific cause and effect kind of a thing. Any healthy mother is at a risk of having a baby with congenital heart disease. If you look at the population incidence, it is about 1 in 100 pregnancies has a risk of having a baby with congenital heart disease. But if there is a family history of heart disease, suppose it's a mother who has already been treated for a congenital heart disease, the risk of her having a baby with congenital heart disease is much higher. With the first child being affected with congenital heart disease, if the mother is going to have another child, the risk is certainly higher than what she started off with. So if the risk was 1% to start with, if there is a sibling with heart disease, it goes up to 3 to 4%. Very common one is the 21 trisomy or the Down syndrome. So these children have increased incidence of congenital heart defects. At the same time, some congenital heart defects have more association with genetic syndromes. Okay. For example, there is one form called the microdeletion, the 22q microdeletion, usually associated with many forms of congenital heart disease, and it is also known to affect other parts of the body other than the heart itself. So it is very important for the child's development and other types and other organs of the body. So these specific genetic abnormalities have a direct effect. Otherwise, any general population has a standard risk of having a baby with congenital heart disease.
Is there any like a lifestyle routine or something that affects or increases the risk of congenital heart disease?
When we see right now in this current day and age, if you see, there are many young adolescents and young women who are falling in the unhealthy range of being obese or overweight.
Right.
And due to the lifestyle changes and many other factors, Many of them are afflicted with what we call, polycystic ovarian syndromes or the metabolic syndromes. So these young mothers develop diabetes very early in pregnancy. So if you ask me, and lifestyle modification as such, any healthy mother herself has a standard risk. So if the mother also is exposed to other risk factors, then she carries a more risk.
So how is this heart defect diagnosed? Like, what are the symptoms of heart disease in children, and how does someone also get to know that if their baby has a congenital heart defect?
Yeah, when we talk about congenital heart diseases, they usually, as long as the baby is inside the mother's womb, even if the defect is already present there, the baby does not show any effect of it. Once the baby is born and the baby gets accustomed to the circulation and the factors outside the mother's womb, that is when the heart and lung has to start function on its own. And that is when these kind of defects start presenting. When we talk about general congenital heart diseases, not the critically ill ones in the neonates, they usually present when the child is around 1 to 2 months of age. Some of them may have difficulty in feeding, they may get breathless while feeding, they get very sweaty and tired while just sucking on the breast, because that's the only activity they do, right? So when babies are trying to feed from the mother, they become very tired and they really get exhausted. And other thing is, in some where we call the cyanotic heart diseases, that is the commonly called as a blue baby. These babies usually have some hint of cyanosis in them, or the blue color. Any newborn, any child is supposed to look pink and really healthy. Other common things as children grow up, they generally tend to have difficulty in performing normal activities, like they get breathless playing, they're not able to run around, they sometimes feel their own heartbeat, which they complain as a fast heartbeat, or able to feel their own heartbeat, which we call in technical terms as palpitations. That is because of the heart pumping at a very high efficiency, we would call it. So, and in some cases, because of this kind of exertional symptoms, babies don't gain weight like other children. Any mother who is having a second-time child will be able to tell definitely that this child is not gaining as much weight as the baby should, in spite of feeding well and the difficulty in feeding and all that. The other thing is, when these children develops any kind of respiratory infection, this is a very common, like a common cold, right? Any child will develop common cold. But these children with congenital heart defects, they really develop serious forms of respiratory infections. Like a common cold won't pass off like a common cold in 4 to 5 days. They go on to develop pneumonias. They require to be hospitalized, and they will need intravenous medications. Some may require more oxygen. Sometimes that's when the child first time presents with a pneumonia, probably that's the first time when you do an echocardiogram and find out that this child probably has a congenital heart defect.
So, doctor, how long can one live with congenital heart defect?
That's a good question. Many of these congenital heart diseases, most of them will need to be treated, the critical ones in the immediate newborn period or less than 1 year of life, or whenever the child gets symptomatic. There are very few defects which will actually not require any active intervention. Like there are some forms of small holes in the heart which will usually close up on its own as the child grows up. How long can a child live with congenital heart disease? Untreated heart diseases, definitely the child will have a limitation to his lifespan. But when you treat the congenital heart disease, we are certainly trying to give the child as normal a lifespan as possible, like any other child. Again, it depends on the complexity of the congenital heart disease. There are some defects which we call are totally correctable. So if it's a totally correctable heart disease, at the end of the surgery, we have something like a normal heart like anybody else. So such hearts they are likely to have a very normal lifespan. But of course, since they are an operated heart, they need to be under constant checkups. We need to do investigations to make sure their heart is doing well. And we certainly need to look for certain other, on the way, if we are going to meet any other complications, we need to keep a close check on them. By and large, many of them, once they undergo the corrective surgery, they tend to have a near normal lifespan. And there are some very complex heart diseases where we are not able to correct the heart totally. We try to do what is called the palliative procedures. Okay. In palliative procedures, we try to make them less symptomatic. We try to adjust their circulations to the extent that the complications of the heart disease doesn't occur. So this has to be done in stages and has to be done at the appropriate timing to achieve its effect. So such children also have got some kind of limitation to their lifespan because their heart is not yet fully corrected.
Right. So if we come after that diagnosis, like now, if we have diagnosed it, what's the next step? If you could, take us through the whole journey of the treatment, explaining different methods and the procedures involved.
Yes. So if you ask me about congenital heart disease treatment, there is a small percentage of them, as we discussed, which may not need treatment. We can just follow them up, right? Okay. The majority of them will definitely require treatment. And again, it depends on the complexity of the heart defects. And the amount of effect the heart defect has on the baby's normal function. That is when we need to intervene. So small, like defects like holes in the heart or some kind of obstruction to the blood flows in the heart, like what we commonly call as the septal defects. There is something called the atrial septal defects, the ventricular septal defects. Some of these defects are usually when they need any intervention is when the effect of these holes on the heart is really significant. So they can be intervened either by surgery or without surgery. Many of them in the smaller neonates, when the magnitude of the problem is really large and the location of the hole is such that it needs surgery, many of them need surgery to fix these holes. Some types of holes, and particularly the atrial septal defects, some very few types of ventricular septal defects, these can be intervened without surgery in the form of what we commonly call as the pinhole surgery, like the intervention procedure. So in the cath lab, it can be closed with a device, what we call. It's like a button-like thing made of. It's an artificial thing which can be used to close these holes.
Okay. So if we talk about the recovery time, how long does a baby takes to recover from such surgeries? Like,
if you ask me about children, they are just up and about once their pain is off. So like more than the heart disease itself, like when we tell, like suppose I counsel a set of parents that their child needs heart surgery, they are more worried about the surgery than the heart defect itself. So they say, like, why should I put my child through the surgery, through the suffering of surgery, through the suffering and pain of surgery? So that's when we try to explain to them that the suffering of pain of the disease is actually much more. If you want to relieve your child of the suffering of the disease, then we as well put the child through the suffering of surgery. Of course, it does carry some risk, but under standard precautions, with standard care, many of these children have very good outcomes. So depending on the complexity of the surgery, they usually spend about 5 to 7 days in the intensive care unit, after which they are ready to feed, and then they come back to the ward, and then like in the maximum in some 10 days to 2 weeks time, they are like ready to go home and get discharged. Possibly in another 2 months time, they are back in all their activities.
So are there also any after effects that negatively impact their life?
Of course, like when I told you these conditions where you're not able to correct it, when they are palliated, they do have some limitation of activity. And many conditions have certain complications of surgery which we are supposed to follow up them for many years to come. Many of them may require an operation another time to redo the whole thing in some time. So by all probability, they could assume normal, like the idea of operating children is they go back to normal society, they're able to go to school, play and have fun like any other child, right? At the same time, we do advise them that, not to indulge in too much of competitive sports, which involves very rigorous training. But any average child, what the child can do, cycling, yoga, swimming, dancing, whatever, many of these children are able to do. In fact, all of them are able to do those things.
Coming to the prevention, when it comes to pregnant couple, for example, what should they keep in mind before childbirth, for better development of their children in the
Of
womb
course, as I
itself?
told you, a very healthy mother is needed. Yeah. So as I told you, it is important to have a healthy mother, without any other problem, for her to be sure that she will have a normal baby. But again, as I told you, the kind of standard risk which applies to the population applies to everybody else. But again, today, with the increasing in technology and expertise, it is possible to diagnose these defects very early in pregnancy. Sometime, like within 3 months of pregnancy, it is possible to at least suspect, number one. And by 5 months of pregnancy, it is when there is expert scans being done, it is possible to even diagnose many of these congenital heart defects. But again, once we diagnose a problem inside the mother's womb, there is no way we are able to treat it when the baby is still inside the mother. But at least we can make a plan for the baby once the baby is going to be born. We know what to expect. There are no surprises after the baby is born. We can be with the family through the journey of pregnancy and delivery, and then we'll be able to reassure them, what we'll be able to offer to this baby once the baby is born. So especially in this like the conditions called the critical congenital heart disease, where the early surgery is required, we can be very much prepared for it before the child actually develops a complication of the disease.
Okay. Well, I think we had a great discussion. Sincerely appreciate the time you took up. Thank you so much.
Thank you very much.